Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Is Ozempic the miracle shot for weight loss, or just another overhyped drug? Let's cut through the headlines and break down the science versus the hype behind Ozempic and its newer rival, Zepbound. Ozempic, also known as Semaglutide, is a GLP-1 receptor agonist. It was first developed as a weekly injection for type 2 diabetes, because it helps the pancreas release insulin and thus lowers blood sugar. But doctors soon noticed something else. Patients were losing weight. Here's why. First is appetite control. Semaglutide mimics the gut hormone GLP-1, which curbs appetite. Second, slower digestion. Semaglutide delays stomach emptying, so you feel full for longer. The gist? GLP-1 drugs make people eat less. This effect was strong enough that semaglutide was repurposed for weight management. And that's how Wegovy, a high-dose version, came to the market. Then came Zepbound, a drug combining GLP-1 and GIP agonist activity, through its active ingredient Tirzepatide. Clinical trials show that people taking semaglutide lost about 15% of their body weight on average. That's around 12% more than those on placebo. With Tirzepatide, the numbers were even higher, averaging around 18 to 20% weight loss. These results are far better than most older weight loss medications. And beyond the scale, semaglutide has been shown to lower blood pressure and reduce the risk of heart attacks or strokes in people with obesity. A big deal, since cardiovascular disease is the world's leading killer. But do these benefits make them a miracle cure, or just another tool that comes with strings attached? Like any drug, GLP-1 agonists come with side effects. The most common are nausea, vomiting, diarrhea, and constipation. For many, these fade over time. But some patients find them intolerable. More rarely, slowing down the gut too much can lead to serious complications. There have been lawsuits over cases of stomach paralysis and bowel obstructions. While these are incredibly rare, patients need to know that they are a possibility. And there are other unknowns too. Some studies suggest possible risks of pancreatitis and gallbladder disease. There are concerns about lean muscle loss along with fat, with rapid weight reduction. And because these medications are still relatively new in the weight loss space, long-term safety data is limited. Doctors are still figuring which patients benefits most, and which patients might face more harm than help. The Food and Drug Administration approved this drug for people with obesity, which the agency defines as a body mass index of 30 or greater. Additionally, the FDA makes exception for patients who don't quite meet that threshold, but have a related condition like high blood pressure. There are different reasons why people want to lose weight. Many seek them purely for cosmetic reasons. While some providers do prescribe off-label for this, experts stress that these medications are not lifestyle replacements and are not meant for casual use. Certain patients, such as those with a history of certain cancers or severe gastrointestinal disease, should not take them at all. Medical supervision is non-negotiable. These drugs require monitoring, dose adjustments, and follow-up to prevent complications. A lot of people start these drugs to look better, hoping for a dramatic makeover. But the results don't always match the glossy image on social media. Weight loss usually plateaus over time. But for some people, they have certain ideas of how they want to look. So when the weight loss plateaus, they're disappointed. A well-intentioned weight loss journey might turn into obsession and gets out of control. Some of the weight lost is muscle, not just fat. And that matters. Because losing muscle can lower your metabolism, reduce strength, and make it harder to maintain weight loss in the long term. It also raises the risk of frailty, especially in older adults. And then there's what many now call Ozempic face. This happens when rapid significant weight loss doesn't just shrink the body. It also reduces fat in the face. Without that natural fullness, the skin can appear loose or droopy, making lines and wrinkles stand out more. Our faces actually need a layer of fat to look smooth, plump, and youthful. But when weight comes off too quickly, the skin often can't keep up, leaving a saggy, aged look instead of the refreshed appearance people expect. On top of that, some patients report fatigue, gastrointestinal discomfort, or changes in body composition that don't match the fit and toned image promoted online. In short, the Ozempic body may not look or feel like what you expect. And unfortunately, one of the biggest challenges is weight regain. Studies show that when patients discontinue semaglutide, most regain the weight they lost. That means for many, treatment isn't short-term, it's potentially lifelong. Add in the high monthly costs, and this raises questions about affordability and sustainability, for individuals or for healthcare systems. Ozempic is effective and represents a real breakthrough in obesity management. They can be life-changing for some patients. But they are not magic. These are medicine. GLP-1 agonists require commitment, medical oversight, and realistic expectations. So before calling them miracle shots, it's worth remembering that the science is strong, but the hype often leaves out the fine print. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.